Your feet are on fire, or maybe they're completely numb, and you'd probably almost prefer the burning because at least that means you feel something. You've been to your doctor. Maybe you've seen several doctors. They've run tests, probably prescribed gabapentin or Lyrica or Cymbalta, and told you just to manage the symptoms, and you're going to have to live with it. But here's what no one told you is that neuropathy doesn't have to be a life sentence. And the reason you may not be getting better might have nothing to do with how bad your case is. Might have something to do with how it's being treated. Hi, I'm Dr. Rebecca Gibbons. I'm a licensed acupuncturist and registered nurse, and I have spent many years helping patients with conditions that conventional medicine just doesn't have the tools for. And so a lot of my patients have been say I have to live with it. So today I wanted to walk you through what peripheral neuropathy actually is, why so many patients are stuck in the cycle of medications that don't fix the problem, and what a real path to recovery can look like. This is episode 1 of our neuropathy series, and by the end of it, you're going to understand your condition better than many patients who've been dealing with it for years. A lot of times there's just not a lot of education out there for patients. So let's start at the beginning. What actually is peripheral neuropathy? Your nervous system has two main parts: your central nervous system, your brain and spinal cord, and your peripheral nervous system, which are all the nerves that branch out from your spine and travel to every corner of your body. That includes your hands and your feet, your organs, and your skin. So peripheral neuropathy is damage to those peripheral nerves in your hands and feet and organs. And when those nerves are damaged, they stop doing their job correctly as the symptoms come on. They either stop sending signals, which is why you feel numbness, or they start misfiring constantly, which is why you feel burning, tingling, stabbing, electric sensations, tightness around your feet, feels like you're walking on rocks. There's many different symptoms. So the most common symptoms, though, that my patients come in with are the burning or tingling in the hands and feet. And it's often worse at night. And then they start to notice balance problems because numbness, a feeling like your feet are wrapped in cotton or tightness, or that you're always walking on something uneven. Then, of course, comes the most dangerous is the balance problems, because the nerves that tell your brain where your feet aren't working properly. Weakness in the legs or feet is also another symptom, and in some cases, sharp shooting pain that can come from out of nowhere and last a few seconds. So if this sounds familiar, not imagining it, these symptoms are real and they are measurable. We can see nerve conduction changes on testing if you've had a nerve conduction test. This isn't in your head, it's a physiological problem. So now, where does peripheral neuropathy develop in the first place? Because understanding the cause matters enormously for how we treat it, at least in our medicine. The most common cause is diabetes. High blood sugar over time damages blood vessels and nerves, particularly the small fiber nerves in the extremities. This is called diabetic peripheral neuropathy, and it affects tens of millions of Americans. The second most common that I see is due to chemotherapy. Chemo-induced peripheral neuropathy, or CIPN, is incredibly common and often under-addressed. So patients are told that it might go away, just wait. Sometimes it does, often it doesn't, and those patients end up suffering long after cancer is in remission. Other causes of peripheral neuropathy could be B12, deficiency, autoimmune conditions like rheumatoid arthritis or lupus, and sometimes medications for thyroid disorders. Alcohol use is also an issue because it's a neurotoxin. So, and then there's times that we don't even know where it comes from, and that's idiopathic neuropathy. But here's the critical thing to understand is that regardless of the cause, what we're dealing with is damaged nerve tissue that has lost its normal function. And the question is, the real question is whether that tissue can be supported in healing. Conventional medicine says no, they don't have a lot of tools. I've seen the opposite though, time and time again at our clinic. And I want to be careful here because I have enormous respect for Western medicine. I was in Western medicine for over 15 years as an RN. I trained in it, and I still believe in it. But my patients have often had neurologists and primary care physicians they trust, and they should. But they just, again, I know it sounds repetitive, they just don't have the tools in their toolkit. They just have medications or injections. And the standard medical approach is also just focused on managing symptoms, not on healing the underlying nerve damage. The most commonly prescribed medications are gabapentin, Lyrica, amitriptyline, Cymbalta are pain management drugs. They work on your brain's perception of pain, but they don't repair the actual nerves. They do not improve circulation to the nerve tissue, and they do not restore function. And for many patients, they don't even manage the pain very well. So I see patients every week who are on maximum doses of these medications and are still suffering, who have been told that this is just what life looks like now. We just have to manage it. So the reason that conventional medicine struggles with neuropathy isn't because your doctors don't care. They absolutely do. It's because the tools they are given are not designed for nerve repair. They're designed for symptom suppression, better quality of life maybe. What's missing from the conventional conversation is, what does the nerve tissue actually need to heal? It needs blood flow. It needs oxygen. It needs neural signaling to be stimulated. It needs the body's own healing mechanism to be activated in the right areas. This is precisely what our treatment approach is at our clinic. So, at Acupuncture and Wellness of Pensacola, we treat peripheral neuropathy using a comprehensive approach that combines acupuncture and then other non-invasive, non-pharmacological therapies, including something ATP resonance biotherapy that helps with the mitochondria of the cell. These are evidence-based approaches to stimulating the body's own healing system. We have to lay a good soil for the body to heal. So we improve microcirculation to damaged nerves. We reduce inflammation and reactivate neural pathways that have gone quiet. I'll go deep on each of these up in the upcoming episode, but here's what I want you to understand today. Nerve tissue can heal. It heals very slowly and in some of the slowest healing tissue of the body, but it does heal. And that's why I usually see my patients, 2, 3, 4 months to get that healing to really come about. So patients who commit to consistent treatment, who don't give up after 2 or 3 weeks because they expected instant results, those are the patients who get all of their functions back. I have patients who have came in barely able to walk because their feet were so numb that they couldn't feel the ground beneath them. And then I've had patients who hadn't slept through the night in years because the burning and the tingling and that horrible feeling has kept them up. And then week by week, we notice it's starting to get better. The symptoms are starting to slowly go away, and balance and numbness improves. So who is a good candidate for care? In general, if you are dealing with peripheral neuropathy, regardless of cause, you are worth evaluating. That said, the patients who tend to respond best are those who still have some sensation remaining, even if it's a little distorted. Completely end-stage neuropathy with total loss or sensation over many years is harder to address, But the majority of patients I see are not at that point, even if they feel like they are. So if you've been told that there is nothing more that can be done, I'd invite you to get a second opinion, because in my experience, that conversation is happening far too early and far too often. And I just feel like people are giving up way too easily. So if any of that, any of what I've shared today resonates with you, if you're tired of managing symptoms and ready to explore another type of recovery, love to talk. And if you're ready to take the next step, give us a call, or you can visit our website at awpensacola.com to learn more. We serve patients all across Pensacola, Gulf Breeze, Pace, Milton, Destin, and all the way over to Mobile and Bruton. And if you're anywhere in the Panhandle, we'd love to hear from you. In the next episode of this series, we're going to go deeper into the 5 most common causes of neuropathy and what each one means for your treatment. So make sure you subscribe, hit the subscribe button so you don't miss it. I'm Dr. Gibbons. Thank you so much for trusting me with your time today, and I hope this was the beginning of something better for you.